Health services in France are stretched as the country faces a triple epidemic and general practitioners are on strike. At the same time, French doctors have gone on strike for the second time this month. The week-long walkout over consultation rates and fees and working conditions came after a two-day strike on December 1st and 2nd. The strikes have resulted in a drop of 30% in general surgeries.
Beds are becoming increasingly scarce, with patients staying longer and longer, since the services themselves are unable to take patients to structures, either for rehabilitation or at home, and with closed beds, in particular geriatric beds. This has a direct impact on us, with the result that patients are on stretchers for 24 to 48 hours, which did not exist 2 years ago, and which is also getting worse this year, especially on the Haute-Pierre site, and in particular for the elderly. And this is indeed, in a way, shocking.
Organizers are calling for the basic price of a medical consultation to be doubled from around $26 to $53. The European average is $48. These fees are usually covered by medical insurance or the state to ensure that most patients can be sheltered from the extra costs. The protesters say that the spike in compensation is the only way to retain young doctors who are increasingly fleeing the profession. This would also help in combating, quote, medical deserts, referring to areas where there are not enough doctors for the number of residents. The medical staffers are also protesting changes that will allow nurses to prescribe medication and provide certain treatments, claiming that this will undermine their role.
Alors c'est compliqué, mais on essaye de
It is complicated, but we are trying to find human resources. We have brought back medical regulation assistants who were in training, for example. We try to mobilize the regulating doctors so that they come at certain times of the day to reinforce us. The SMER doctors, when they are not in intervention, also come here to the regulation center to give a hand, and so on. Every day it's a new adventure and we try to organize ourselves on a day-to-day basis to cope up with the influx.
The nationwide strike, the first since 2015, is unusual in both its length and scale. It has not been called by unions, but by a new group called Doctors for Tomorrow, which claims to represent as many as 16,000 practitioners. It is the first time that many doctors will be closing their surgery doors. France is battling a high number of coronavirus cases as well, while infants are being hit particularly hard this year by bronchitis and elderly people influenza. This triple epidemic has placed an already stretched healthcare system under extreme pressure.